interim report, intermedio, dolor ciático, so sciatic pain, 60% mejor, 60% better the sciatica. Okay. The dolor de espalda, the back pain, low back pain, 80% better, 80% mejor. Bueno. Mood, depression, 50% better. Your mood is much better. Okay. So I'm going to show you of them because they look very similar. So what happened here is this first, so your leg deficiency has changed. You initially had a 14 millimeter leg deficiency. Now it's at 10 millimeters. So there was a 4 millimeter leg deficiency change. When L5 was the problem, when L5 was subluxated, when that had shifted back and was choking off that nerve supply there, it was creating that nerve interference, it was causing a spasm that made your left leg look, or your right leg look shorter than it actually is. So there's a 4 millimeter leg difference there, so that's good. Now there's still a lot of this going on. I don't know how permanent this is or not, depending on how long that has been in there, but you're starting to, if you look at for something like T11, you can see you're not touching the vertebrae. T11, now you're clearly inside it. So the body is trying to adapt to that, but it's looking better. Now let's go to the microdiscectomy at age 18 at L5, which was the problem. They had the right segment, but their treatment was not the right thing to do. The vertebrae had shifted back by 5 millimeters. Now that's back by 2 millimeters. It's much more in normal alignment here. Now, you can see the body adapting here. This was 77 millimeters to the posterior, to the most posterior thoracic. This is now 68. So the body's coming forward a little bit. Now, if you look at the neck looks like it has a better curve on this initial x-ray. But if you look at the palatine plate, you could see the way your head was when this picture was taken. Your head was like this. So it was putting an artificial curve in compared to here where it's very flat. When you're in a lot of pain, very often people will have their heads up like that. I don't know if it relaxes the spinal cord, but this is very common. So, but you can see it's more normal now with 67 millimeters posterior. Ideally, we would like to see that. It's now 40 millimeters to the center of the dens. So you're moving forward, so everything's looking very good, okay? Now, I want to hear from you. Tell me a little bit about where you're at.
Fue algo diferente porque sentí algo que ya no había sentido durante 2 años. El poder disfrutar de un concierto sin estar preocupándote de, uy, mañana voy a estar mal. O en el mismo momento, no sentía el dolor. Simplemente estaba como que disfrutando el momento, ¿sabes? Como los demás, como todos los demás. Y antes no era así, porque antes, aunque no se oyera, yo era el único que no lo disfrutaba. ¿Sabes? Y eso me cambia bastante desde el ánimo de disfrutar las cosas, desde el pensamiento de todo. Definitivamente como persona me cambió bastante. Yeah.